Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. I'm very excited to be talking about a new topic for Rational Wellness, which is breast implant illness. Now, for those of us like me who are not really familiar with this topic, I decided to look a little bit into the history of breast implant illness. Does it even exist? And what do we know about it? So I decided to take a very conservative route. And so pretty much everything I'm going to say now is coming from the FDA. Now, to be objective, a lot of people feel that the FDA is a bit too chummy with the medical device industry, given the fact that a number of members of the FDA have come from this industry and big pharma and have gone back to work in industry after being at the FDA. But so just so you know, that everything I'm saying now is coming directly from the FDA. So none of this could be considered as should not be considered as controversial. So silicone gel breast implants were first introduced in the United States in 1962. In 1976, the U.S. Congress passed the 1976 Medical Device Amendments to the Federal Food, Drug, and Cosmetics Act. Breast implants were considered moderate risk, class 2. Then in the early 1980s, concerns arose about the safety of breast implants, especially silicone gel implants, and the FDA identified frequent local complications and adverse outcomes and published case reports identifying possible cancer and connective tissue disease in some women with breast implants. At that point, the FDA reclassified breast implants into class 3 higher risk products needing pre-market approval and called the manufacturers to provide data demonstrating safety. In 1992, the FDA removed all silicone gel-filled breast implants from the market due to safety concerns. In 1999, the Institute of Medicine released a report that concluded that while there were lots of local complications and health concerns related to silicone breast implants, like rupture, pain, capsular contraction, infection, that there was no evidence of systemic health effects, such as cancer or autoimmune disease. So in 2006, the FDA approved silicone breast implants, specifically Allergans and Mentors, based on 3 to 4 years safety reports from the manufacturers. But the FDA also required the manufacturers to conduct 6 post-approval studies, which would take a longer period of time. In other words, the breast implants are approved, but because there's a risk, they want the manufacturers to conduct these post-approval longer-term studies for safety. Recently, last October of 2021, the FDA ordered stronger warnings for breast implants, including a boxed warning in which the risks were listed on the packaging. Of course, how many women actually see the packaging on their breast implants? Some of the risks that the FDA highlighted in the report include capsular contracture, implant rupture, and possible silicone gel migration into surrounding tissues, systemic breast implant with symptoms that may include systemic breast implant illness with symptoms that may include fatigue, memory loss, rash, brain fog, and joint pain, and breast implant associated anaplastic large cell lymphoma, abbreviated BIA-ALCL. interesting. We have the FDA at one point in time saying there's absolutely no risk of cancer. And now we have a cancer that's absolutely tied with breast implants. So it just goes to show you how science changes and evolves with changing evidence. So anybody who comes on TV who says this is what the science is, this is what the truth is, needs to be humble and realize that's based on what evidence is currently available, and that evidence could change. Danielle Valoras is with us today, and she's a certified physician assistant and the founder of NavWell Rx PLLC, an integrative health practice. Danielle is the originator of the Breast Implant Health Summit, and she brings over 20 years of experience in medical research and education to her clients. She specializes in Psycho-Neuro-Endocrine-Immunology, which is a burgeoning field that investigates the link between the nervous system, the endocrine system, and the immune system in relation to physical health. And since we talk a lot about gut health and we talk about the gut-brain immune connection, this is actually not something that's unusual for our listeners. And Danielle's practice integrates Western medicine, functional medicine, trauma response, and clinical bodywork therapies. She treats autoimmune diseases, chronic fatigue, and implantable device-related illness such as breast implant illness. Danielle, thank you so much for joining us today.
Thank you, Dr. Weitz. It's a pleasure to join you. And I've listened to you for so long that I feel like my education came from here. So I appreciate you very much.
Okay, well, I thank you for that. So, we were talking off air a little bit, and you said you're working with the FDA. Can you tell us a little bit about that? And maybe can you comment about the introduction I just gave, because you are much more of an expert at this than I am.
Yeah, I would say I am in communication with the FDA versus working with them.
Oh, okay.
Just for clarity.
Helping to supply them with some information.
Yeah, and hoping to move the dial further with different, not disciplinary actions, but like the black box warning or fully informed consenting and that type of partnership. There's not just me, but a group of women behind this movement. And as you can see, since actually 2018, 2019, we've actually made some pretty significant strides, and we hope to have more in the next 3 to 5 years as well. My background as a PA since 99 is one thing, but I've also worked in the medical device industry as a field clinical engineer for Class 3 medical devices.
Okay.
So it's sort of, my world sort of merged. And I look at the clinical study and the clinical evidence that we don't really have for the breast implants. And it just pushes me forward to do more.
So perhaps you can tell us about your personal story related to breast implants.
Yeah, my personal story is I was 48. I lost 40 pounds. I was in the best shape of my life. And I saw myself in the mirror and I thought, if there's ever a time to get breast implants, now would be the time. And so I did. I did some research. I looked at the FDA approval. There were no warnings. I looked at the 2006 SSED, which is the summary of safety and effectiveness data that goes along with it. And this is part of what I had done for my full-time day job as a Class 3 field clinical engineer for cardiology. So I thought I had it all together. And then I chose a physician, a plastic surgeon, to put them in. I put them in, and literally for me, it was like 3 to 4 months later, things just started to happen. And it correlated with the time I was studying functional medicine, and, timeline and history is everything. And it pretty much. By
the way, did you get to see the label on the box?
No, that was before the label existed.
Oh, okay.
But what did exist, so I have a thyroid disorder called Graves' disease that's been treated.
Right.
And so anyone with,
hyperthyroid.
Yes. And so anyone with an autoimmune condition should be very careful with implantable devices, especially like breast implants or even asthma, right? And that's in the labeling and in very small italicized print on the manufacturer's website, but you don't know which implant you're going to receive. It may be one company over another. And so that was never brought up in my informed consent. And in theory, I should never have been implanted because of the autoimmune issue that I had. And I was. And looking back from hair loss to connective tissue issues, like I tore both meniscus in each knee and swelling and the ankles. I should send you pictures so you can see, and the hair loss and the fatigue and the acne. And, it looked like autoimmune issues, but my antibodies at the time actually were normal, at least the ones we were measuring for.
Now, when you say you shouldn't have had the implants because of autoimmune disease, does the FDA currently recognize that breast implants may cause autoimmune disease or exacerbate autoimmune disease?
I would say that they say autoimmune disease or history of is a risk factor, and breast implants should not be placed in that population.
Okay, so they're recognizing that there's a relationship with autoimmune disease.
Yeah, a correlation might be a more politically correct word.
Okay.
Well, I mean, I don't want to necessarily speak for the FDA, but there is, and they made the manufacturers list that on their websites as well. And actually, relatively recently, they now have to go through a pretty decent informed consent for everyone who will get breast implants. And if they fail to do so, then it's against regulation, and hopefully folks would be held accountable for that. But yeah,
okay.
That's a mouthful.
So can you comment about why breast implants were taken off the market and then approved? Go ahead and finish your story.
Oh,
yeah. Are you finished with your story?
Basically,
No.
So at the end of the day,
Right.
my symptoms just kept getting more and worse, and
Right.
We thought it was physical. The weight of the implants, the brachial plexus, right here, the lymphatic system, all of the above, and then I removed them, removed the capsule as well, and I'd say I got about 70% better. Like right away.
Is that a significant factor, removing the capsule? Is that not always done?
It is not always done. And in my self-experience, as well as with clients, when they remove all the capsule, there's a greater or a less inflammatory response, especially if there's silicone in the capsule. So
why would they not remove the whole thing? Why would they not remove the capsule?
Well, if you think about it, and I wish I had a model, for under the muscle, right? You've got the rib cage like this, and you've got the pec minor, and then you've got the pec major here.
Right.
So they'll cut the pec major to make place for this implant. Whatever size it is, usually that pec major has to be cut. And that sits right on your rib cage. So you've got ribs, intercostal space, ribs, intercostal space. And what's right behind there are the lungs or maybe even pericardium, depending on which way they are displaced near the sternum. So to scrape that off the back wall risks a pneumothorax, risks puncture. And it could be dangerous, especially if the plastic surgeon is not versed into getting the capsule off, right? There are plenty of experienced explanters out there that can do the whole thing. But this brings up, I know we're digressing a little bit, but this brings up a great opportunity to talk about the capsule, which is the scar tissue, which is the catcher's mitt for whatever is in the device, in this case, a breast implant, or whatever's in the shell, and whatever comes out of that, right? From off-gassing to silicone to platinum to whatever's in that catcher's mitt. And that catcher's mitt gets formed. And sometimes we don't make a very good catcher's mitt. There's that theory. And then sometimes we make what they call a Baker stage 4, which is very, very thick and a robust catcher's mitt, right? And so there's so much in that surgery to remove it. And sometimes it can actually get up to the brachial plexus and way up to the collarbone. So there's some delicacy in there. But that tissue being the catcher's mitt, to remove that, I feel is imperative because it is the catcher's mitt. And if we just, right now, all I know to do is focus on silicone and platinum, because I know that it can get through the capsule into the body. There's enough literature on that to support that. But there are beliefs that maybe that's not advantageous to remove for the person. But I do think that it's important, and that'll be an arm wrestle for the next 3 to 5 years.
Is it better not to have the implant under the muscle? Can it be over the muscle?
It can be over the muscle, and it's the capsule that forms is still a catcher's mitt, and you're still right here in a very innervated and lymphatic rich area that you still have the consequences, but you don't have the cut pec major, right?
I've really been enjoying this discussion, but I'd like to take a minute to tell you about a new product that I'm very excited about. I'd like to tell you about a new wearable called the Apollo. And this is a device that can be worn on the wrist or the ankle, and it uses vibrations to stimulate your parasympathetic nervous system. And this device has amazing benefits in terms of getting you out of that stressed out sympathetic nervous system and stimulating the parasympathetic nervous system. It has a number of different functions, especially helping you to relax, to focus, to concentrate, to get into a deeper meditative state, even to help you sleep. And there's even a mode to help you wake up. And this all occurs through the scientific use of subtle vibrations. For those of you who might be interested in getting the Apollo for yourself to help you reset your nervous system, go to apolloneuro.com and use the affiliate code Weitz10. That's my last name, WEITZ 10. And now back to the discussion. I heard you say in another interview that you ended up having very high arsenic levels, and somehow this catcher's mitt capsule helped, you think, affect why you had these high arsenic levels? No,
I actually think so. This is just a theory of mine. Okay. The implant definitely has metals, right? Like, I mean, it's listed.
Right. But platinum is very common, right? Platinum is used in the
cross-linking. Oh, yeah.
Why is platinum put in?
Because it makes the silicone more solid. It makes it more gel-like. It makes the shell, right? And so, there's so much to say.
Right.
So
it's like making your paint, put the lead in the paint to give it real good textures.
Yeah. Yeah. I didn't even go there, but absolutely. And so you do this, and some of the silicone doesn't cross-link, and you never have a perfect cross-link. So maybe instead of this, I feel like I'm doing an example of leaky gut right now, but instead of this, you actually get something like this. Right. And then what comes off the shell is silicone and plus or minus platinum. Right. So for me, I think the implants causes our methylation system to disrupt. And I think that's why I had high arsenic, because as soon as it was removed, my arsenic level went down. Right. Within 2 weeks, it was normal. But before, it was quite high. So
your body's detoxification capabilities to remove the normal amount of arsenic that unfortunately is contained in our food wasn't filtered out.
That's my belief. It just happened so fast that, if it was something that was stuck in my system, it would have been deposited, and It was the fastest chelation if it was just from the breast implants, I think. But right. I do think it's an endocrine disruptor, a methylation disruptor, and an inflammation cascade, right? And so depending, I don't even know that it depends on your genetics. I mean, it does. There's some risk factors there, right? But I think that this is enough of a toxic load, especially over time for some, that it will cause expression of the different genetics that we have. So and we know that the silicone is eventually going to leak, right? Isn't it the case that virtually every woman, if they have the breast implants for a long enough period of time, they're going to have leakage, right? Well, if I can, let's back up just a minute.
Okay.
Because the shell is silicone.
Okay.
Of saline implants, of silicone implants.
Okay, so if you don't get the
implants,
shell out, you automatically have silicone that's coming that's coming into contact with your other tissues.
Well, the shell of the implant and then the capsule for sure.
Right.
So every implant out there is made of silicone. And people think, oh, I have saline. It's made of silicone. The outer layer.
You're saying the saline breast implants have a silicone on the outside.
Yes, silicone platinum cross-linking to hold everything together and in. But we're finding evidence that it's the shell that sheds. It's the shell that biodegrades. It's the shell that is the initial insult. Okay,
so even forgetting about leakage of the silicone gel, the shell is shedding silicone into your body.
Yes. And there's something that Dr. Eduardo Flore from São Paulo, Brazil, he's a radiologist, MD, PhD, and he studies silicone-induced granulomas within the breast implant capsule. And so whether it's saline or silicone, you can see the silicone granuloma, and then you can, so look up his research. It's really wonderful.
What is a silicone granuloma?
It is basically silicone that's gotten out of the shell of the implant, and your body's responding to it. And your body is wonderful, right? So it develops, it attacks it, and
an immune system response.
Yes. And I think specifically for most, it's a T cell response. There are some B cell response to the breast implant that causes a different type of cancer. But T cell is BII, which is breast implant illness, and T cell response is BIA-ALCL, which is the lymphoma caused specifically by the breast implant. So it's a granuloma. The immune makes a response and an attack to it. And then you're dealing with this inflammatory cascade from the get-go. Now, you have a catcher's mitt, right? Which is the capsule that your body formed around it, which 3 to 4 months, you should have some sort of scar tissue in place. But it also, when you have that inflammation, biofilm forms, right? And that changes your normal flora. And there's a whole other podcast we can do on that. But it causes a cascade that the body has to handle. And can your body handle that inflammatory response? Does it have enough? And chronically over time, toxicity in my world breeds deficiency. And sure, we can replace the deficiency, or we can try, but it's always going to be a load. It's always going to be a load. And if that was our only load, other than glyphosate, other than, all the leaky gut and the different things, it would be, maybe we would be able to handle it better, but.
We have a good test for silicone?
We do not. The best test is an MRI. It's a breast MRI with or without contrast. And I would say with contrast gives you the higher yield to see if you have that silicone-induced granuloma. It's not quite for silicone, but we have blood tests that you can look for silica and silicone, but the molecules in which they're testing for isn't necessarily the breast implant. Now, if you have a frank rupture, maybe this would capture that. We do have silicone sensitivity tests that we can do, but in my patient population, I've never seen anyone positive with the sensitivities for silicone. For other things that are in the breast implants, like when you do the environmental toxins and stuff, you can see those all high, but silicone never registers for these people, and they are very sick.
What about urine? Same,
right? You can test. We see people doing a lot of heavy metal testing. Those will be disrupted because I think of the methylation more than what is in the implants causes this cascade of disruption. I don't know that what you're measuring is because of the breast implant, like mercury is for fillings. So there are tests that I use to help get methylation in the Krebs cycle, really in the mitochondria, more robust. And that's an organic acid test for me. And I tend to use Great Plains because they show the oxalates. Vibrant Health also shows oxalates. And what I find actually is that we are more deficient, significantly deficient in B6 and B1, and adding those over the folate and the B12 move the dial more, better, different while you are opening up the drainage pathways. That's key. Get things moving.
Now you're talking about treatment for patients with breast implant illness.
Yeah. I think there might be a little bit more to say about the capsule, making sure the capsule's removed, and then the silicone granuloma for testing for illness. Dr.
Yeah,
Tovar.
let's continue to talk about how breast implants cause illness. How do breast implants lead to autoimmune disease? What is the immune system reacting to that's causing cross-reactivity?
That's a great question. And if I knew that specifically, it would be, I could retire. But what I know is that there is reaction.
Calling Dr. Vashtani, we need your help.
Silicone and platinum seem to be the biggest foes, and the two components of the breast implants that we know cause a certain cascade, right? So the cross reactivity, I don't know. Like, I'm sure there's more, and I hope he does call.
So we do know that breast implants cause cancer, this specific form of cancer, anaplastic large cell lymphoma.
Yeah. And that's a T cell cascade specifically to the silicone.
Okay.
What you'll find interesting in the literature by Fleury and Suzanne Turner is if you look at their work and you sort of extrapolate the T cell, what you'll see in Fleury's work is he finds the silicone-induced granuloma before BIA-ALCL, before the lymphoma, and also before the BII. Right? So what we don't know is what causes the T cells to proliferate to make lymphoma, and what causes the T cells to stay in a certain way for BII, right? Now, they're going to say that the literature is based on textured implants for the lymphoma, but you see the same granuloma and on MRI before and with BIA, ALCL, and BII. So
when you say BII, for everybody, she's talking about breast implant illness versus BI versus the breast implant associated cancer. Yeah.
Yeah. And let's be specific, like that's just one of them associated with the textured implants, but there's sarcomas, melanomas, there's many other cancers that are linked to the breast implant.
What are some of the other common cancers that are linked with breast implants?
Melanoma and sarcoma.
Okay. And sarcoma of bones. This is or soft tissues or what?
You see the granuloma, and the biopsy shows that it's a sarcoma related tissue. That's in the literature.
Okay.
For me, right? Like it's within the breast implant capsule, and you can see. Oh, so remember how we were talking about the shell?
Right.
So once you have these openings, things can get out as well as in. And so I think that's where the irritation and the granulomas begin. And how it deforms, I don't know.
Okay. Okay, so go ahead. So sarcomas and what other kinds of cancer?
I've read on melanoma. My patients haven't had the sarcoma or melanoma.
Okay. And I heard you talk about some of the gastrointestinal symptoms related to breast implant illness and how this can be a cause of leaky gut. And I personally treat a lot of patients with IBS and SIBO and leaky gut. And I wonder if this could be one of the reasons we don't consider for patients who don't improve as much as we had hoped.
If anyone has an implantable device and they have GI issues that, we try, I think we need to dig further. Like the question should be for every patient, do you have an implantable device? Some people don't consider IUDs as an implantable device, right? Some patients don't remember they have a dental implant or they've ever had a root canal or things like that, but they definitely are inflammatory. And if that person doesn't have enough reserve to handle inflammation, total inflammation, I don't, it's hard to move the dial.
So unfortunately, though, it sounds like from what I've heard and read so far that if somebody like me is working with a patient with gut problems and we suspect that there might be a breast implant related factor, there's not one definitive test I can do to say, yes, we know your breast implant is part of the problem.
Correct. But I think as practitioners, we should be knowing what is in the person's body in their history, right? We'll have to decipher from history and suspect that possibility. And just there's something called the Bradford Hill criteria, and there's a Dr. Jan Tervaart out of Canada who just published a paper on how he diagnoses breast implant illness and the evidence for it. If someone comes to me with breast implants, or they just come to me because they're tired, right? And we take a full history. I now, for the past 4 years, have been asking, do you have an implantable device? Do you have breast implants? Do you have a penile implant? Do you have dental implants? Let's go down the list, right? Do you have a pacemaker? Do you have a fake hip, fake knees? Like we go through it all. And, there's some of those that are things you can do about, and there's some that like a pacemaker would be really hard to remove, right? So at least we know that if you have a mesh, that's a whole other conversation. That inflammatory cascade is very similar to breast implant cascade as well. And if we're going for the low-hanging fruit at first, we're going to decrease inflammation, right? Oxidative stress, all of that, and work with the gut, right?
So you find that these meshes, which are, say, for example, common in hernia surgeries and some of these other surgeries where
pelvic
surgeries,
they also can cause, let's just call it an inflammatory cascade for now, but and it's so embedded in the tissue, just like some of the breast implants and the capsules are embedded into the tissue. And the granulomas that occur with them are of concern, right? Some of these procedures are elective. And so we are now putting devices in people that cause inflammation. And, our first job is to do no harm. So my brain just went in 5 different directions. I'm like, what else do I want to say about meshes? But meshes can cause the same issues for sure.
But meshes don't have silicone, right? They're just made from plastic of some type.
They are made of What are they made of?
Polycarbonate or something like that, I believe, some of them.
Yeah, and I think they're
I mean, I had one put in for a hernia in 2000.
And what are your symptoms? No, just kidding. No, but if you can, again, toxicity breeds deficiency. So I have women who come to me who have all the signs and symptoms and even have SIGBIC on MRI, and they're not ready to remove them. They may never be ready to remove them.
SIGBIC is silicone-induced granuloma breast implant capsule.
Yes. So sorry.
That's okay.
But they want to keep them. Okay, so let's empower you. Let's be totally informed, and let's see what we can do to help you have vitality in life, right?
So let's go over how you could treat from a functional medicine or integrative perspective a patient who comes to you with some sort of illness related to breast implants or even other implants.
Yeah. Number one is ask what they have inside their body, right? Okay. We ask them the supplements. Some of the women who come, I can't tell that they have implants, but they've had them in for 20 years. Right. So if they've had a breast implant set or second set in for 20 years or over 7 to 10, we're having the conversation that they don't last a lifetime. And there's something to be considered for changing them out, or at least getting imaging to see if they're ruptured. Right. So I start there. And so then if they get the imaging and they don't have SIGBIC, like let's say their implants have been in for 3 years, but they're still feeling crummy and they don't have SIGBIC, then it's an informed conversation of, we don't see the granuloma yet. By the time we see the granuloma, we know that silicone is outside of the implant into the capsule and potentially has migrated through the body. And then, as we know, your body may or may not create antibodies to this, and you don't know where this cascade of silicone will land, right? And then we'll take another MRI in a year or in 2 years, and we'll follow it that way. Now, if they have SIGBIC, the conversation is, you have inflammation in your body. The breast implant is leaking. We know this because of the SIGBIC. And now what do you want to do about it, right? And do you want to go for explant? Do you want to, how do you want to have vitality? And so we'll do an organic acid test. We'll sometimes do a Dutch test and a stool test and see what we're dealing with. We'll do the Lyme and the EBV. Okay. And what sorts of things might you find on those tests, and what will that tell you? And then what do you do about it? Oh, you see a toxic load usually, and you'll see methylation issues. You'll definitely, if anyone doesn't see a low B6, I would like to see that because I haven't seen that yet. You'll see low B6. You'll probably see high oxalates. You'll definitely see candida. You'll see going down the list, plus or minus. A lot of these people. Now, why would you see candida? For me, I think it's just, I think people want me to say metals, but the methylation disruption and, the inflammation, it's a very, now it's a very overwhelmed body, it's a great environment for it to grow. And now this is organic acid, right? So this is in the urine even. Sometimes you see mold. You see, mycotoxins for some of them. I see that a lot with specifically saline. I'm going down the organic. Why would you get mycotoxins with saline breast implants? Yeah, that's a great question, because it's not necessarily, is it being introduced? Is it inside? Is it introduced during the surgery? Is it inside the implant? Is it in the body and we don't know it? In some places it grows. I don't have the answer. I wish I did, but I don't. But you do see it, right? And some of these, and sometimes, maybe that's where it lands because they've had mold exposure before, right? Some of these women have been exposed to Lyme. They're co-infections, and a lot of people have EBV or mono and that gets reactivated, right? So a lot of the functional medicine, in the beginning, I was just treating that and not considering the implantable device, right? And didn't really make much headway with that. Oh, there's so much to say. The people who I see have mold and have that sensitivity, like a mast cell, like a histamine response. They can't eat too much. They can't take supplements, right? Their nervous system is just off the charts, right? Those are the tough ones. And I need more practitioners to share their stories, how they help these patients and how, I don't see those patients being able to not explant.
I'd like to interrupt this fascinating discussion we're having for another few minutes to tell you about another really exciting product that has changed my life and the life of my family, especially as it pertains to getting good quality sleep. It's something called the Chili Pad, CHILIPAD. It can be found at the website chilisleep.com, which is CHILISLEEP.com. And so this product involves a water-cooled mattress pad that goes underneath your sheets and helps you maintain a constant temperature at night. If you've ever gotten woken up because the temperature has changed, typically gets warmer, this product will maintain your body at a very even temperature, and it tends to promote uninterrupted quality deep and REM sleep, which is super important for healing and for overall health. And if you go to chilisleep.com and you use the affiliate code Weitz20, that's my last name, WEITZ 20, you'll get 20% off a Chili Pad. So check it out, and let's get back to this discussion. Is there a way to detox silicone or some of the other things associated with breast implants? Is there a silicone detox program?
Open up all the drainage pathways, keep it moving, heat.
And how do you like to open up drainage pathways?
Lymphatic drainage massage. I use something also that I instruct the patients to use something like block therapy. So in my practice, I do osteopathic manipulation. So we'll do visceral, we'll keep that moving, flush the liver, and manually do that. Do heat with sauna. Make sure you're able to sweat, breath work, like all the drainage pathways, breath, liver, kidneys, urine, feces. And
some doctors talk about using herbal bitters to get bile flow. Some doctors talk about there's this
Tudka,
exactly,
taurine, like
right.
It's all of it. It's most everyone under this chronic stress for some length of time have decreased HCl. And like, there's things like if they have edema, like that HCl is going to really, or some other kinds of enzymes that could really help that patient, like opening it up from the mouth to the stomach, to the liver, the bile duct, the gallbladder is usually a mess. When you look at the organic acid, most of them, but I think this is true for many of our autoimmune patients, is their amino acids are so low, and either they're not taking them in or they don't have enough of what it takes to break it down. Right. So, you just start with the basics, open it all up, and that tends to help. So.
Okay. And what else can we do to help patients with breast implant illness besides detox?
Yeah. So the nervous system, right?
Okay.
And listen to the patient, create a safe space for that patient, because by the time they've found a functional medicine practitioner, they've probably been to at least 5 to 10 others, right? And
right.
They've been to the ER so many times. And so, just to listen and to create that safe space for them. I think that provides so much healing. Replace the deficiencies. I tend to start mitochondrial, Krebs cycle first, and that seems to move the dial quite well.
What does that mean practically? Exactly which
B6, B1, and I don't do B complexes because you need so much more than what that can offer, right? I mean, the magnesium, the electrolytes, these people are adrenal fatigued, so you go that route as well. I'm assuming people who are listening know how to beef up the adrenals, take away the stress. Breath work is amazing. The rest is like the full functional medicine profile. And initially, explant has proven to decrease the symptoms. And then it's, for me, I call it nutrient enriching and opening up the drainage pathways. That moves the dial the most. You just had Todd Watts on not too long ago. When I added the Cellcore products to these women, we're actually going to do a clinical study, a feasibility coming up. The carbon technology just shifted things to faster. Now, the people that have very high sensitivities or mast cell have got to go really slow, but following they're opening up the drainage pathways, addressing viruses, addressing parasites and different things has really impacted the health of the BII population quite well. I'd like to say I had it really good before, but I added this and it's even better. So I'm going to start a HOPE clinical trial. It's called How to Optimize Post-Explant. We'll be doing 20 women. It will start in 2022. I think we'll be doing it at 2 plastic surgeons' offices who explant, so we can, track everything that we know to track today. And we'll see the people who have not improved at the 3-month marker. They will see if they meet the inclusion-exclusion criteria, and those who have explanted before an end of a year. So we'll get this population that wasn't all the way helped and they still have symptoms post-explant, and we'll see if we can move the dial with what we're talking about here, and hopefully give other practitioners okay, I'm going to do it this way, right? At least a correlation if we can.
Okay, cool. So you said you would use some products from Cellcore that help to detox and clear out parasites, and you found this really helpful.
Yeah, and if even just their phased approach, right? I think that just, it makes sense to open up the exit door before yelling fire, right? Otherwise, you think about that for estrogen, right? You work on, you give dim all day long, and 2 is not, you don't have any amino acids and the different things. You're not going to have what you need to succeed in that. So doing the same approach, I think, will work in implantable devices for the women. So there's nothing that, the problem with silicone on the periodic table is that it's right underneath carbon. So I think one of the things that Cellcore has is its carbon technology. So silicone will bind to a carbon site. And how do we release it? Well, the only way you can release it is to fold it. How do you fold it? Maybe heat it, change its oxidative state. We don't know this information. I wish I could say, oh, take an istatol and that'll do it, but it doesn't, right? So you need to unbind it in many of the cases. And then you need to make sure carbon binds with that while you're pushing the silicone along. So that's why moving, lymphatic, breath work, exercise, sauna, you're heating it. We're doing everything we can to change our own oxidative state. I don't know necessarily how to impact that bound silicone and change its oxidative state, but I can heat it with sauna. I can do some red light therapy. I can manipulate it, but there's not full data on that. That's just what I've clinically found that works.
Great. Fascinating. No, it's great. A lot of stuff to think about, and it's hopeful that we're getting more information about some of the health effects of these silicone and saline breast implants, and that there are some strategies that are helping women with these and potentially similar problems with other people who have other sorts of implantable devices, including mesh.
Yeah. That's going to be an interesting cascade for sure.
Have you had hernia patients?
Yeah. More like fatigue and like dampened symptoms. Not, by the time we breast implant people have autoimmune, we went through the whole autoimmune trajectory. I mean, you're not diabetic today, but you weren't yesterday, right? Like, so there's this behind here.
There's this long pathway. Yeah.
I don't know that mesh leaks like the shell of the implant. So I'm not as, I think it causes irritation and inflammation, and depending on how you build the scar tissue, but it doesn't have the same structure as a breast implant shell does. So while it does cause issues, I don't know that it will impact. I think it would impact less, but we don't know.
And then, of course, we have individual response. You have, 4 people in a house with mold, and one of them gets really sick, and one of them gets mild symptoms, and the other 2 never have any symptoms.
Yeah. One of the things we're going to look at in the HOPE clinical study is we'll do a full DNA panel, and we'll see if everyone talks about, I'm MTHFR. What about GST? What about, what about all these other things? And I think we're going to find correlations there. And then, so for people with mesh, I would look at the same thing and see. And then at the end of the day, all we have is choice to optimize. And there's some things like pacemakers, and they had polyurethane leads and silicone leads and platinum tips or platinum iridium tips, right? So we're not going to remove them, but how do you optimize that patient? But knowing what this can cause may help. Like, is it inflammatory? Is it oxidative? Is it that? And that, I think, is functional medicine 102, right? So
great. So any final thoughts for our listeners and viewers as we wrap this up?
Yeah, if there are practitioners out there that see breast implant illness or related complications from PT's functional medicine, we host every other year a Breast Implant Health Summit. This year will be October 2022, and I'm looking for more practitioners to speak what they do, right? Because it takes a collaborative team if we can heal these people more, better, different, faster, that's the goal. So if people would like to either have more information on the Breast Implant Health Summit or present at the Breast Implant Health Summit, then please connect to me through the breastimplanthealthsummit.com, and that would be a great way to connect.
Excellent. Thank you, Danielle.
Thank you very much.
Thank you for making it all the way through this episode of the Rational Wellness Podcast. And if you enjoyed this podcast, please go to Apple Podcasts and give us a 5-star ratings and review. That way, more people will be able to find this Rational Wellness Podcast when they're searching for health podcasts. And I wanted to let everybody know that I do now have a few openings for new nutritional consultations for patients at my Santa Monica Weitz Sports Chiropractic and Nutrition Clinic. So if you're interested, please call my office, 310-395-3111, and sign up for one of the few remaining slots for a comprehensive nutritional consultation with Dr. Ben Weitz. Thank you, and see you next week.